Hello everyone, I'm Dr. Avinash Chaitanya, Head and Neck Surgical Oncologist at Care Hospitals, Hyderabad. Today I'm going to tell you about thyroid cancer, how it is different from any normal thyroid nodule, and what is the treatment. So, as you all know, having a swelling in the thyroid region is quite common, especially in females, but most of the times it is a benign, that is a non-cancerous swelling. But how do you know that it is non-cancerous? Clinically, can we decide whether it is cancerous or not? Those are the questions I'm going to answer in the coming video. So basically, thyroid nodules could be of two types. It could be a benign, which is non-cancerous condition, or a cancerous nodule in the thyroid. Basic suspicion arises when there is a symptom which is associated with cancer. It could be either hoarseness of voice, which is of a recent onset. It could be difficulty in swallowing, difficulty in breathing, any nodes in the neck, which can be dealt upon the history or in the examination of the patient. Sometimes, but very rarely, we may even see patients presenting with hemoptysis because the tumor has spread inside the trachea, to which the thyroid gland is attached. So, when in the presence of these kind of symptoms, we have a high suspicion for having a thyroid cancer. And when we suspect the thyroid cancer, how does the line of investigation change? It doesn't change much, because the first test that we do is going to be the same as we do for benign tumors. So we do a thyroid function test, we do an ultrasound, and we do an FNAC to confirm our diagnosis. Most of the times these investigations are sufficient, but in case there is a lesion which is infiltrating, or when you suspect it might be a bit difficult during surgery, we may get additional tests like a CECT of the neck or an MRI or any other test for that matter. But is the treatment very difficult? It's not very difficult and not very different from benign tumors. In thyroid cancers, we just have to do a total thyroidectomy, that is, remove the thyroid gland as such in which the tumor is present. If there are any nodes in the neck, we have to remove those nodes also. But after this treatment, what is to be done? Do I need to undergo any chemotherapy, radiotherapy? Most of the times, no. Most of the times, in a differentiated thyroid cancer, it is sufficient to take iodine therapy in the form of a syrup, which can be taken a month or so later after the surgery, and that could be the end of your treatment. So, thyroid cancer, it is a simple tests, simple solutions, and also it leads to a very good post-treatment life. So much so that you can actually lead a normal life without any comorbidities if the treatment is done right. So don't worry if you get a diagnosis of thyroid cancer, we can treat you well. Thank you.